Hey, Tracy! What are you doing here?
Wow, cipai kasih dia. Oh.
Thank you, thank you, thank you.
What have you been doing?
I show you my secret
Okay.
place.
Begin your senior living journey with us. Let's live a happier, healthier life together.
Hi, good afternoon, everyone. Welcome to the webinar, Next Generation Cellular Therapy. Thank you for spending your afternoon with us today. My name is Christina, and I'm going to be your host. Silver Circle by Commune Wellness is an ongoing webinar series with curated sessions conducted and supported by our community partners, as well as other industry experts. This month, we explore a range of topics and discussions that can help us gain and apply knowledge for a better future. Like with our previous sessions, we hope to connect with seniors to create a community that engages in current topics of physical and social well-being. So if you're in post-retirement, just retiring, or planning for retirement, we'd like for you to join our conversation. So stick with us today and take part in the Q&A to score some prizes from Commune Living Bangsa South. All you have to do is fill up the event form at the end of the webinar, and don't forget to take part in our Q&A session. So before we kick off our discussions today, I would like to take this time to introduce to you Commune Living and Wellness, the largest integrated co-living and wellness hub in Southeast Asia. A co-living hotel, senior care, and wellness hub all under one roof. We envision this to be the place for seniors to be living it up as they embark on their next chapter. Nestled next to Taman Tasik Permaisuri, a 99-acre park with close to 900 service suites, Commune Living and Wellness is focused on creating a holistic living environment for seniors where care and wellness facilities and services are readily accessible. So community is at the heart of this development. And in line with this, Commune Wellness will be organizing a host of activities in collaboration with our senior care partners, like one today, where we will see activities that relate to fitness, workouts, leisure activities, talks and courses, workshops, and group sessions like outings and excursions. So basically, seniors will be able to make meaningful engagements and experience all-rounded fun, where they will be able to maintain somewhat of an active lifestyle while retaining their independence. So we're opening our doors to you next year. And if you have any questions or if you would like to get in touch, our details are up on the screen right now, along with a QR code for you to scan on your mobile devices. I'll leave that up there for a few more seconds for you to take down the necessary information. Right, so moving on. Today, we are joined by Dr. Lan Leong Chung. Dr. Lan started as a general practitioner in 2002 before furthering his studies into medical aesthetics and regenerative medicine. He became a recognized trainer for multiple types of medical procedures such as fillers, injection, hair implant, with main interest in thread lifting. Regular webinar and hands-on courses are being conducted by Dr. Lan at his training center, Cellular Biolab Academy in Kuala Lumpur. Dr. Lan further ventures into the field of regenerative medicine and established his R&D lab in 2004. Sorry, apologies, 2014. Backed with 20 years of medical experience, Dr. Lan now not only provides the best alternative medicine and lifestyle therapy for his patients, he also provides training sessions and webinars for other doctors who have interest in the field. Welcome, Dr. Lan. Before I let you take over, I just wanted to do a bit of housekeeping. If you have any questions during the presentation, please type them into the Zoom Q&A chat box. We will bring them up at the end of the presentation. Now, without further ado, we will turn the time over to Dr. Lan.
Yeah, good afternoon. Maybe I share my screen first.
Go ahead.
Yes, good afternoon. My name is Dr. Lan. I'm from Kuala Lumpur. So nice to meet all of you all today. So today my topics, I think, is a very simple. So next generation of the cellular therapy. So a lot of people are asking, so what is cellular therapy? So what is a cell therapy? So this is basically, it's a cell-based therapy in regenerative medicine. How are we going to use the cell, the live cell, to treat and also to prevent the diseases? 在华语方面呢，我们就说这个是再生医学之细胞疗法，我们是用细胞来做这个预防跟治疗方面呢。Okay, so before I start off, I think the topic that I'm going to touch before I start off, I think the most important, we need to know our human body cell in details. Though that is really important for us. Okay, and then what is the aging process and our body immune system is before we actually move on. So next, of course, we are going to talk about this so-called cellular therapy, what type of cell we are going to use in this cellular therapy, that is a natural killer cell and also the mesenchymal stem cell. And what is these two cells going to do? How can we apply this cell-based therapy in this regenerative medicine? If you look at the left corner, these two terms is also very important. So at the end of the presentation, definitely you'll be very understand what is the meaning of all these terms here. Believe in the power of your own cell. The second thing is the healing power of the stem cell. These two words later, once we finish all the presentation, I'm sure you'll get all the points here. So before I start off, I will say we need to understand the physiology of our human body cell and the aging. Then it's much more easier for us to plan out the treatment preventive medicine. So in our human body, so there is total about 30 trillion cells make up of the very complex tissue in our body. Out of these 30 trillion cells, so how many types of cells we have? It's come to over 200 different cell types in the human body. So if you look at this number, it's really, really huge number. But every day, just imagine every single second, there's a 300 million cells are dying off. So it means per day, if you're calculating per day, is about 25 trillion cells are dying in a day. So how can we still living with such a long period since we body have the 30 trillions of cells and then we are dying almost 25 trillions of cells every day? Because our body have a very special cell, regenerative cell, keep on producing the cell. So the number 4 point is 10 to 15 trillions of cells are formed every day. So this is our human body cell. So just for your simple information, what is a trillion? We know million cell, billion, and come to trillions, actually is a 12 zero digit, and then with one number is we have in front. So that is a huge number, 30 trillion cells. So every day there's a cell dying. But of course, our body have the power of regenerate and reproduce the cell to replace those old cells. This is the human body cell. So the hallmark of the aging, we say, usually is because of the stem cell exhaustion. So if you look at this diagram, this graph, the number of the cells and the activity of the adult stem cell rapidly decreases with the age. It means when we born, newborn, we have a very high number of the stem cell and also very high activity of the stem cell at early stage of age. So when we growing up, the number and activity of this cell actually start decreasing. So this will cause the aging issue. So it means when you age, all these which have a very powerful can replace the dying cell who have a regenerative power cell, actually is the number and activity is start declining also. So another theory behind this aging by this professor from Japan, he actually stated this is very clearly, there is an accumulation of the senescent cells, which is an old cell in the tissue and organ as we get older. So if you look at these 2 points, once we getting older, our regenerative cell in our body, the number and the activity is decreased remarkably. The second thing, whatever the infant newborn stem cell, when we start to grow, it actually differentiate into our body system organ cell. Later, this cell also become the senescent cell, and then it start to accumulate in the organ. So these two things to make our body start aging. So there is two types of the aging. What is a type of aging? We say two types. One we call is an intrinsic aging, which also known as a chronological aging, 内在老化. So this is actually inevitable physiological process with the genetic lock. So we cannot stop the aging. Of course, we cannot reverse the aging, but definitely we can slow down the aging. So this intrinsic aging actually affected by the degenerative effect of free radicals in our body. Body's inability to perfectly repair their damaged cell. So due to what? Due to because of the reduced activity and the number of the stem cell. So this result in the thinning and dry skin, and then the fine wrinkles and gradually dermal atrophy. So everyone will go along this physiological process aging, but we can age actually healthily. So we cannot reverse for sure. We cannot stop the aging for sure, but of course we can slow down the aging process and make the whole aging process more healthily. So another type of aging we call extrinsic. This is because of the external environmental factor, which such as air pollution, the cigarette smoking, poor nutrition, all this sunlight exposure. So it will cause a lot of damage to our skin. So this is called extrinsic aging. So extrinsic aging actually can be avoided with a healthy lifestyle, everything. So this is the two types of the aging. So what are the signs of the aging? So external experience, of course, is not very important nowadays because with such a so advanced aesthetic technology and those procedures, aesthetic procedure, plastic surgery, I think the external appearance basically, it can be changed. It can be reversed. If you have a lot of wrinkle, you have any pigments, you have any sagging, laxity of your skin, it can be done by any aesthetic procedure. But what is important in the aging is how can we prevent the systemic, our internal organ, which can function very normally and more normal. It means today, if you have a 30 years car, which is the engine doesn't work, you can have a good painting externally, but actually the car doesn't move. So there's no point. So this sign of aging, usually we are more worried about is the memory loss, reducing the attention and all the body response. And of course, we are trying to prevent the aging disease, especially the Alzheimer, which is a lot of people worry about, can't remember even their families and members' names, the Parkinson disease, rheumatoid arthritis, all those we call as aging, systemic aging of our internal organ. So what we need to do basically to slow down this, or we make it more healthily aging, not the external appearance at all. So once we finish, we understand how we age our body, humans cell. So how many cells we have every day, how many cells that die off because of a body with the potential to replace this cell and regenerate the cell. And then, so now we come to our human immune system, 人体的免疫系统。So 人体里面有3种免疫系统。So quite commonly, we are seeing innate immunity and adaptive immunity. So what is innate? One, actually, this is a 先天免疫. So you're born with this natural protection immune system. So we have another is adaptive. Adaptive means today, let's say I have a COVID infection, my body will start to produce my own antibody against. So this immunity during exposure to the disease, or now even the vaccination, we still group this as an adaptive immunity. So what about the passive immunity? This is quite seldom we have seen this passive immunity, but during this COVID, I'm sure some of you have heard about this. Let's say today I have an infection of this COVID. So my serum will have a very high antibody. So we can draw my blood, concentrate down the immunoglobulin fraction, and then inject to someone to have to protect. So we call this passive immunity as a borrow immunity. You borrow my antibody to protect you. So this is, I'm sure you have heard about some of the VIP also doing such thing when the vaccine is not available. They draw someone's infected patient serum process and to treat the COVID. So this is one of the we call as a passive. Another common passive immunity we have seen. I'm sure everyone's family do have a pregnant mother. So for those pregnant women, why we give the tetanus, anti-tetanus toxoid to the mother? Because we need to generate this antibody in the mother. It will pass through the placenta to the baby. So during delivery, when we cut the umbilical cord, we are not worried about the tetanus. 也就是说，怀孕的妇女，我们没有理由在这个肚子里面跟她打疫苗嘛，会跟这个小孩打疫苗，所以我们就打在这个怀孕的妇女身上。所以它会产生这个抗体，在这个 delivery 的时候，它就不会感染到这个 tetanus. So this is what we call passive immunity. So these three basically form our human immune system. Like what you look at here, adaptive, we have our B cell, T cell, which is also called as a memory cell. So once we got the infection from externally, trigger our body to have to develop this antibody. Next time when this same antigen or the infection comes to our body, we can against it. This is an adaptive immune system. Innate is totally different. Like our skin also considered as an innate immune system, or all the lining of the mucus. And of course, if you look at the next picture here, so immune cell, the NK cell also considered one of the innate immunity. Once our body got any infection going on, this cell will come immediately to attack, to protect our body. So today, later, we are going to explain how does it work? So this is our human body immune system. Like this graph, I like to show this graph later. I will going to show again. This is what we call innate immunity. When we have a virus title, once you expose to the virus infection, let's say example, current pandemic, the coronavirus infection. So the virus title will start to grow very fast within 24 hours to hit about 5 days or a week. So if your body immune system is strong enough, especially the NK cell, natural killer cell is strong enough, we call innate immunity. So it will start to fight against this virus and bring down the virus title. So if your immune system is strong, usually whenever whatever infection you got it, you might not experience any much of the symptoms. So by about a week later, our body will generate the antibody, natural antibody. This is called adaptive immunity, who will go against this bacteria. So with this background, we say how's our body cell at what is our aging's concept theory behind with the immune system. Let me talk about today's main topic, the regenerative medicine by using these two types of cells. How can we clear our body and how we can replace the new cell? So in regenerative medicine, we call 再生医学. You have two very important components. One, we need to detox, like what the Prof of Japan told, the aging because there's accumulation of the old cell inside our body and organs. So we need to clear all these aged cells or those damaged cells. So because of the intrinsic and extrinsic issue exposed to all the externally, our cell might die off. So what we need a detox. We need the detox to clear up all these aging cells. How we do it? We can use our own cell, autologous natural killer cell. This is the 自然杀伤细胞。So 这个叫排毒细胞来的。So 在再生医学里面，我们就第一步呢，我们就需要做这一个我们叫排毒，但是不用药物来排毒，反而用我们自体的杀伤细胞。Okay, natural killer cell. We're not using any chemical, but using back our own immune cell. So the part 2 of the regenerative medicine, after we have detox, so our immune cell, everything will build up. So we need something in to repair, regenerative. So this cell will come back, we say we use a mesenchymal stem cell. These two combination actually is the best in the regenerative medicine. So what are the function of the NK cell? So NK cell 的功能是什么呢？这个自然杀伤细胞呢，它可以自界杀灭我们体内的癌细胞。It can kill all our cancer cell in the body. 它退化老化的细胞，它也可以帮忙清除那些病变细胞，就是有生病了的细胞，已经变质 mutated cell, which is infected cell. All this can be cleared by this NK cell in our body. That's why the NK cell actually provide the first line of the body defense in innate immunity to protect our body by clearing all these type of unwanted harmful cells in the body. So where can we get the NK cell? I think we'll leave it. So we're talking about this NYJ1633, one of the products which is actually recognized by the Japan FDA. The contain this autologous NK and NKT cell. Very simple to get our own body by using this technology. We just need to draw our own blood. We isolate the NK and NKT cell up. We start to culture and multiplying, and then followed by QC check everything. By 12 to 14 days, try to make about 2 billion cell, 2 to 3 billion activated cell, and then deploy to the body. And then it will do their detox work for our body. So 这个是非常简单的一个疗程，就是说，只要我们抽取我们的血液的 sample， 然后呢送进这个实验室、化验室里面抽取这些 NK cell， 然后我们繁殖它，然后我们 activate 它，就是给它活跃了过后呢，在12到14天 就把这整批的2个 billion 的这个细胞打进身体来做一个排毒，So who needs this NK cell treatment? So for those who want to to boost their immune system, what I mean the inner immunity, if you have a very high activated NK cell, of course you're protected from this external virus infection. So those anti-aging, yes, of course, this NK cell will help to clear all these accumulated aging cell in our organ and the tissue. So of course, come to the cancer prevention. Yes, later we are going to explain to you how does it work, and then persistent high tumor marker. For the treatment part for those cancer in all stages, autoimmune disease or any infection and the immunodeficiency disease. So all this actually is indicated. This is a newsletter from direct from this Immunist Bio Korea, which has stated this MYJ1633 is actually for the treatment of glioma-derived cancer stem cell. They have 100% killing effect in just 12 hours. So what does it mean by this circulating the tumor cell? Let me explain a little bit about this. If your body have, let's say it's a cancer patient, will have the body have a primary cancer site. This cancer cell will start to spread to the circulating blood circulation. It might go to the lymphatic system, and then it starts circulating to other body of the cell, structure. So another is for healthy people like me. Anytime my body might have this type of what is so-called cancer stem cell. It's a baby of the stem cell. It might not turn to the cancer in the future. Let's say it's too much of external factor, it might trigger this cancer stem cell to develop the cancer. So this circulating cancer stem cell actually will moving around our body. It start multiplying if you are not healthy at all. So it always try to invasion and the dissemination of the cancer cell in the healthy tissue. This is what we call stage 4 metastasis. The cancer spread from the ovary cancer spread to the lung, to the liver, or prostate cancer to the bone. So all these cells actually in the circulating blood or lymphatic, it will spread to other structure. Once come to the normal tissue, they will start multiplying again. So if we have this activated NK cells circulating blood, before they turn out become the big tumor, this activated NK cell will migrate toward the cancer cell and it will start to kill, to help us to clear this type of cell. So this is what I mean by circulating cancer cell or cancer stem cell. This is a video show that the cytotoxic study of activated NK cell on the cancer cell. They put this NK cell and cancer cell, which is a pink color. This is a pink color, is a cancer cell. So they put together, you can see this activated NK cell start to actually attack this cancer cell, try to destroy this cancer cell. So this is we can see inside the lab, which this activated NK cell, it works. So this is just a cartoon to show that NK cell basically is a policeman in our body. It keeps circulating the whole body and you start to detect. So who are the abnormal cell? Who is not belong to you? Whatever mutated cell, damaged cell, then once they scan already, they think this is not belong to you, or this might harm to you in the future, and it will start to clear it off. This is what we call NK cell, basically is a policeman of our body, immune system. So another interesting here, what I'm going before we're touching this regenerative is a cancer. I think no matter whatever the organ you name in our body, there is a chance to get the cancer. So I show you some statistics. When I go through this statistic, I also got very surprised. This is a 2020 Malaysia's cases. This is our population, 32 million. If you look at the new number, the number of the new cases of cancer per year in last year is 48,000. If you look at the number of deaths result from the cancer, is close to 30 million, 29.5 million, thousand, not million, sorry. So 29,000. You imagine now the pandemic since last year, March 16, I still remember the day, we locked down. The 1 year, 7 months until today, what is the total death caused by the COVID-19? If I'm not mistaken, I just checked just now, it's about the 28,500 something. That is for 1 year, 7 months. COVID actually had hit Malaysia and killed so much of people. But if you look at the cancer, why no one's worried about this number? If you look at this death from the cancer, we think a year, 2020, it's almost 30,000 people had died of cancer. So I think this is the awareness issue. We need to know that new cases in the last year was 48,000. The death was 29,000. It's much, much more far away from the COVID-19. If you look at another statistic here, in 2018, 2018, we have a total cancer death is total cancer case is 43,000. After 2 years now, 48,000. If you look at the total cancer death in 2018, 2 years ago, that was only 26,000 per year. 26个人死于癌症。但你看今年2020 2020 it's increased to 29,000. So why this number keep on increasing every year? Because of the lifestyle, because of the stressful lifestyle, and because all the chemical, artificial things that the food, even the food itself, is one of the major issue. So in today, I would say the preventive medicine actually play a very, very important role to prevent all these type of disease. We are not going to treat the disease, but we have to prevent it happens. So look at this number. I'm sure everyone's now really know about who is the most dangerous, not the COVID-19 anymore. So cancer also very, very important. So what are the function of the natural killer cell? I repeat again, it actually can clear all these mutated abnormal cells in our body to make you more healthier. Okay, so I skip this COVID-19. So certificate I skip. So it can be used as a treatment for all these autoimmune diseases, psoriasis, skin diseases, as well as autoimmune disease. I think it works very well. So now, in regenerative medicine, the detox part we have completed by using our own autologous NK cell. So this word now you understand, believe in the power of your own cell to help you live more healthily. Now, the second part, I'm going to show you the healing power of the stem cell, means a mesenchymal stem cell. So in regenerative medicine, we definitely need something to detox our body. We definitely need someone actually to repair our body cell, like what from the beginning theory I told you already, because of accumulation of all these aging cell in our body, in our tissue, it causes aging. Because the reduce in the number of the total number and activity of our stem cell in the body, we cannot repair, we cannot regenerate. It causes all this damage to the skin or our body organs. It causes us age very fast. So in this intrinsic, or we call aging process, definitely we cannot reverse because it's a physiological process. But of course, we can slow down for sure if we have a good this autologous NK cell to help us to clear up all the cell. We have this MSC to repair. Let me show you some cases of this healing power of the stem cell. If you do it in the more medical way, if you are doing in the proper, it actually works very, very well. So what is the mesenchymal stem cell? We always call the stem cell. So in the medical, I'm in the medical stuff, I will always like to use MSC. This word, we call it as a yeah, that is what is called the Chinese words. So, okay, this is if someone that presented to you what is so-called MSC, the stem cell. I have a stem cell product. So you have to make sure the stem cell that you are receive, it must be the live cell. And it can be multiplied and it can be renewing. It can differentiate into the body cell that what you require. Let's say your liver's got some issue you need to replace. Yes, that is one of the things. So what is the source of human cell, human stem cell? We can come up from the blood, bone marrow, adipose tissue, dental bar, all these like the fetal, we can get it from umbilical cord blood, water jelly, this and that. So this is the source of the human stem cell. So the MSC here actually is a very, very regenerative potential. It can actually differentiate to all type of cell in our body. So once you come to the cell, the area which have a damage, muscle damage, if you deploy over the damaged area, it heal, it will help for the healing, it will generate a new cell there. So the major significance here basically is revitalize the 5 major internal organs of our heart, liver, spleen, and lung. So you will feel totally healthy. Second issue, of course, is those aging issue. We can actually regulate our sexual hormones. The people are aging is because our hormones, basically sex hormone, is lower down than the cause of aging as well. This is one of the theory behind. So of course, this MSC actually will help too. Deployment part, I think I will skip. So the live cell is very important. So aesthetic part, of course, we can use this live cell to treat all the aesthetic issue. So we call it the stem cell treatment. Like acne, of course, works very well with long-term effect as well. So I will try to skip this one. I think most important, this is just a treatment part, the intravenous. You can deploy intravenous, the thymus, because thymus is one of our immune system organs. So, and then the knee, yes, we definitely need this so-called cell. And then for those who have the brain issue, tissue with the cerebral, the brain, the degeneration issue, definitely we can deploy through the intratheca to regenerate our brain cell. So nebulizer, of course, in these post-COVID cases, definitely we need this actually nebulizer in how the stem cell in actually it helps a lot in all this recovery and improve our lungs function as well. Therapeutic, I'm sure you can work on some of the cases. Let me show you. This is cerebral palsy, one of the kids that we know very well. And then I know this kid at the age of 2 years old. Now already, I think more than that already is, so you're not able to move on. This is, I think, 3 sections were deployed. These kids basically cannot walk. It just can crawl all over. So what we need to do after 3 sections of deployment, 7 months after the deployment, this is the first time the kids actually can walk nicely, okay? And then, of course, this is another, after 9 months, he can climb out the staircase by himself without much of his support. And then, of course, we move on to the Parkinson. It also works very well for the Parkinson. So all this is a regenerative medicine, okay? So if you look at this is a Parkinson or medication, this is after the 2 sections of treatment, 3 sections of treatment, patient can walk nicely. Of course, the most important is the regenerative power for the wound care. This stem cell works perfectly for the wound care. This is the same wound of this Parkinson auntie who's supposed to chop another 2 toes, and then after the repair, 6 months later, even the kidney also improved. The GFR dropped from 20. Creatinine is go up to 121 after the cell therapy actually improved. So like chronic wound ulcer, all these actually can treat the 2 years of chronic ulcer with keloid, it heal wound, all these ulcer. This is the worst case during last, I think, lockdown in the May. With this case, patient walk in with this diabetes wound, with all the wound exposed. I'm sure you go to any of the clinics or any of the hospitals, sure they ask to amputate, to chop off this type of leg. So what we do, we deploy the stem cell all over the leg. I think within the 3 to 6 months, everything healed. From here, we can improve, not improve, we can totally heal this type of cases. Even with the skin color, everything changed back to the normal. So I think the MSC mesenchymal stem cell is a really powerful cell. So like what I say, come back to the same again. So these two, you need the combination, both have their benefit on that. So cellular therapy for COVID infection, we can use as a prevention. Let's say today someone's admitted in ICU, can we use this therapy? Definitely is no. Pre-COVID, to build your immunity, your immune system to protect you to get the infection, yes, the cell therapy is a preventive medicine. But post-COVID, what we can do for those patients, Cat 4, Cat 5, they have about 60–70% of the lung damage. Definitely, we need a biological depot cell, this NK cell, this NKT cell, removing all the damaged tissue cell in our lungs and increase the body immune system as well by using this NK. Then we need another the repair cell in to repair, regenerate the damaged lung tissue, the powerful anti-inflammatory effect of this MSC. So if you look at these two cell combination, we call as a cellular therapy. Definitely it works well for this as a preventive and also as a therapeutic. So believe in the power of your own self, first thing. Second thing, the healing power of the MSC definitely is out of what we are thinking. So that is the reason why this regenerative medicine we call 再生医学，我们是用细胞来疗法，所以预防跟治疗是非常重要。So this will be my last slide for those I think TCM, our partner here, 同心堂, and then TCM. I'm sure most of people will know about prevention better than cure. This for everyone who know how to talk about this prevention better than cure. So it is better to stop something bad from happening than it is to deal it with after it has happened. So it means, so 养生之道啊，我们说养生就是这样，养生就等于我们说转长寿啊，预防永远胜于治疗。我们是避免这个疾病，我们是怎样去调理我们的身体，我们去怎样去保养我们的身体，来预防这些病痛，给我们是老化，老的比较健康的老化。So always prevent always is better than the cure. So with this regenerative medicine, basically we can improve our immune system, we can slow down our aging process, and also to prevent the disease. So I think I end my talk here. Should be nice, 45 minutes. Okay, thank you. 谢谢.
Thank you, Dr. Lan, for the informative presentation. We will probably turn the time over to some of the questions that we have on our Q&A. Let me just go through them real quickly. Okay, so there are a couple of questions. I don't know if you're able to see it, but I'll just pose some of the questions to you. So the first one asks, since Dr. mentioned can use antibodies of high immunity individuals to help prevent COVID, why is this method not promoted in Malaysia or globally?
No, definitely it's not. Definitely it's not, because this is a passive immunity, which is actually very fast in the short term. Because now we have what is so-called adaptive immunity by using the vaccine. So why we need to draw people's blood and process the serum? Definitely it doesn't practical. If you want to immunize, let's say 20 million of our Malaysian population, who is going to donate all this blood is really, really tasty. And then somehow it doesn't last long. These are passive immunity. Yeah. So still we are advised the vaccine is always, we need to go ahead for the long-term preventive.
Okay, thank you for that. So the second question is, how effective is this treatment in Alzheimer's?
Yeah, I would say it's Alzheimer. Alzheimer is one of the degenerative disease of the brain, so brain tissue. So if in the medical way of treatments, the only way is actually treating by using those drugs. But this is only to actually to slow down the process, but it doesn't improve at all. I will use this word. So in the early and the mid stage of this Alzheimer, I think the cell therapy, it actually works very well, especially when you start to deploy this type of cell. First, of course, MSC works much more better than the NK. But since this Alzheimer, most of the time it's happened in the aged people. So we need to build out their immune system. we need to balance up their immune system as well by using this NK cell. Then followed by, of course, is MSC, regenerate the brain tissue. So by deployment only IV, I think it doesn't work for Alzheimer. You need to intrathecal deploy to the direct to the brain tissue. So Alzheimer definitely is a very challenging. In Western medicine, like us as a doctor treatment, I would say the drug is doing to control. So you definitely can combine the drug with the alternative medicine. So this alternative medicine always we practice for those failed medical cases. So actually it doesn't cause harm at all, but it actually to improve the whole general condition. In Alzheimer, I think it works really well, especially this regenerative medicine.
Okay, got it. So a couple more, going through a couple more questions here. So okay, so here's one. So hi, Dr. Lan, can I ask more for people with autoimmune disease? Have you helped patients with autoimmune disease, and is there significant improvement?
Yeah, autoimmune disease, this one depends on which type of autoimmune disease. All the reports we need to go through every details, the past history, and then the past treatment, what the treatment he or she had been gone through, and all the medical reports we had to go through. And then from that only, we can start to plan out the treatment autoimmune. Because the NK cell, not only the NK cell, MSC also, you need this two type of combination, like what we have presented, the psoriasis cases, the eczema, all under autoimmune. Of course, those MS, a lot of other like SLE also under autoimmune diseases. So all these systemic diseases, you need a long-term treatment for at least 1.5 to 2 years period to monitor by using this regenerative medicine. Of course, the traditional treatment, the medical treatment still need to continue until the immune system starts to stabilize, then we slowly wean off the medical treatment. This is how we actually treat the autoimmune diseases. Yeah.
Okay. So I think there was actually a question about the duration. So how long does it take for such a treatment to be effective? Because you mentioned it takes between 2 years or even beyond.
So this is a very subjective, depends on the disease. So every individual respond differently. So what is, I think, indication is very important. What is your expectation is also very important. For anti-aging, I think there's no issue. We need to detox and then regenerate the cell. For all the treatment therapeutic, actually it's really challenging. We need to combine both the medical, we call it the evidence-based medicine knowledge. Right. We combine with this regenerative medicine, alternative medicine, and then need to work together with some other departments as well. So how fast is the effect depends on what type of disease. So we need to sit down to go through all those reports. Only we can give a good detailed comments. Yeah.
Okay. So there's another question here that asks, can we say that NK cells are a better treatment for cancer compared to chemo? Would you recommend this treatment more compared to other cancer treatment methods? And what is the percentage of recovery or remission?
Okay, this NK cell and the cancer, so you all shouldn't have those misconceptions. If today the cancer patient approach me, I would say, let's say today I have a stage 1, stage 2 cancer, or even early stage 3. I always advise my patient, please go for the surgery, see your surgeon, cut it off, do the chemo, do the radio, clear whatever cell, the tumor cell, the mass of the tumor cell first. Once you have cleared the tumor cell, whatever the remaining which cannot be detected, cannot be cleared, I think this circulating NK cell works very well. So when we do the NK cell, if the patient with stage 1, 2, or early stage 3, we advise for the proper medical treatment first before you start this NK as a clearing part. Because the survival rate for stage 1, 2, and 3, if you manage properly, you no need to use the NK. Actually, the survival is very high. But today, let's say someone's approached me with the stage 4 end stage, which the hospital oncologist or wherever surgeon will told, which is non-operable. This is an end stage case, even referred to palliative. Yes, we are using this NK basically to reduce the tumor size, but definitely cannot cure because it's stage 4. We are actually using this alternative medicine to improve the lives, the quality of the life. That is most important, to reduce the pain, to extend their actually lifespan. I think there's the presentation. I didn't put out this slide because some of the, I think in the Korea and the Japan, they have this type of study on this MYJ 1633. For those patients who actually survive for about 2 or 3 months in the end stage, they put up on this 5 to 10 section of the NK cell treatment. They even live more than about 14, 17 months. So this is what we call failed medical end stage. I would more prefer to put on this patient on this NK cell, which is autologous, instead of going through this chemo suffering. And eventually, he or she still need to will pass away again. So I would say most important, live healthily no matter how long you can live. So NK always good for end stage rather than chemo suffering until end of the day. So, but for early stage, please go for the proper medical. After you complete the proper medical, then go for the NK as a preventive to clearing the remaining to prevent the recurrence. Yeah.
Okay. The cancer cells mutate after the therapy, or is it, because you mentioned it's preventive? So I think there is a question here that says, is it possible that the cancer mutates after the therapy?
No, definitely it's not. Okay, if you say mutate, a lot of people say about the cell might mutate if you inject, especially the mesenchymal stem cell. If you know your mesenchyma, the stem cell, the source, you won't have any issue. Some people who have deployed the mesenchymal stem cell, which have the maybe passage 10, 20, or 30, or bought from somewhere else, also don't know what is the origin. There are too much of manipulation of the cell itself. Yes, you are injecting something which is already manipulated, already have an external, what is called chemical, whatever, trigger it to grow, and then you inject to your body. Of course, there is a risk of mutation. But for your autologous NK cell, it will never have such a thing happen because everything belongs to your cell. We take the blood from your cell, multiply it, trigger, become it more active, and then deploy back to your body. So it wouldn't have such a mutation issue. Yeah.
Okay. So it's all within your internal body, nothing external coming into your body lah.
Yeah.
Yeah. Okay. So I think this is another question that I think you might have also presented in your slides. Is cell therapy safe for any age group? And is it just as effective for seniors?
Okay. If you ask this cell therapy, okay, it's definitely is safe for all age group. But let's say today, someone presented to us have no disease at the age of 20 years old. So the selective of the cell therapy, definitely we need to adjust. So with 30 and below, without any systemic diseases, diabetes, hypertension. So this type of case, basically, we are aiming only you can use the NK cell for your detox and build out your immune system. If let's say someone comes with a very, very old or senior, we use the word senior, of course, you need a combination cell therapy. So it's safe for all stages of age. We even treated the age of about 3 years old with this hyperactive child, actually with cell therapy with a very, very good result. Yeah, autism cases, actually it works very, very well with the mesenchymal stem cell. So there's no age limit, actually it's safe for all age.
I see. Okay, that's good to know. And I think we've got 2 more questions before I wrap up. Oh, sorry. I think a follow-up question to the earlier question is if the therapy is available in Malaysia. And I'm pretty sure, I mean, since you have done so much work on it, that it is available here in Malaysia, right?
Sorry, I can't get you, sorry.
Oh, sorry. I just wanted, I think the follow-up question to that is whether the cell therapy is available in Malaysia.
Yeah, of course. The cell therapies now currently is available in
Mhm.
Malaysia. So you mean the cellular therapy usually depends on what type of cell you're using. So this cellular therapy, the current practice, actually we are using this the Japan FDA approved cell therapy, the NK cell, and then we combine with the mesenchymal stem cell. But if the patient is not indicated for MSC, so they can use autologous pure because it's an autologous, you're not using anything, their own cell. Yes, it's definitely available in Malaysia. Yeah.
Okay. Good. I think that's all the questions that we have. You might have addressed some of the questions are repeated, so I think you might have addressed it earlier as well, like the part about the cancer. So I think we're done with the questions, the question and answer session. So thank
Yeah.
you so much
Oh,
again, Dr. Lan, for
yeah.
taking us through the informative presentation and for answering the questions. And we hope that the session today has been beneficial to everybody here. Can the slides be sent to the participants after the event?
Yeah.
Cool. Okay, yeah, I guess we will make the slides available to the participants after the
Yeah.
event. And
Okay.
then you can also access a recording of the webinar on our website, as well as our social media platforms at the end of the month, where you can learn more about commune living and wellness. So also make sure to check out our next session happening next month. We will kick things off with another NK Biocell session, this time around with Dr. Park on how to achieve the famous Korean glass skin, followed by another session with Care Concierge. So registration will be made available soon. And also don't forget to fill out the post-event form right after this. You will stand a chance to win a free one-night stay at Commune Living Bangsa South, or F&B vouchers to be used at Commune Cafe Bangsa South. So thank you again, Dr. Lan, and to everyone else.
Yeah.
Have a great week ahead and stay safe.
Okay. Thank you. Bye bye.
Thanks.
Hey, Sia. Hey, Tracy. What are you doing here?
Wah, chị Bác suy liao.
Thank you, thank you, thank you.
What have you been doing?
I show you my secret
Okay,
place.
Begin your senior living journey with us. Let's live a happier, healthier life together.